Welcome, doctors and caregivers. Thank you for taking a minute to come by Perfect Balance Physical Therapy, the last clinic standing that does good old-fashioned, old-school, one-on-one physical therapy with the therapist and the patient for 1 full hour. We get a lot done. I wanted to give you a little bird's eye view into the special things we have here and why your patients will not need as many physical therapy visits, because we fit a lot in. If you can come over here and see, we have some modalities, we have cold laser, we have stim, we have a variety of different modalities. We have a McKenzie table, which is super fancy, which means we can get passive motion with those patients with very hot discs. This is a chiropractic table. I can do different manual therapy. We can move it around. We can do different kinematics, kinesiology, different techniques of manual therapy. So it's awesome. We can take great care of them one-on-one, show them how to do it at home. That's key, isn't it? And then after that, even more importantly, come along. We have a comfy place to rest and wait and calm themselves and ground themselves when they come in. That's all part of it. Here we have some tea and water, getting that message of hydrating and providing yourself with supportive teas. Why not? And then here we have our activity room and learning room. This is Mr. Bones. And here I put some TheraBand on here to represent the psoas muscle, because learning about the patient's body and exactly what's happening with their own body is key in their recovery, as we know. So we use tennis balls in a sack here to mobilize the spine and the soft tissue all throughout the body. We have TRX straps. We work on balance, strength, aligning the skeleton, the joints, all the joints, neurology, balance. And then we send people home with a program using a variety of home tools. One of our really special elements that we have here at Perfect Balance is Biof Feedback. It's like we fit on steroids. We can give you computerized printout. Here's a great example of the two-leg stability. The days of using two scales on the right and left foot are gone, people. Check this out. So here we go. I probably shouldn't have volunteered myself for this. Okay. Good. So we can see the challenge, and the computer will absolutely keep track of where you are and where your patient is. This is harder than it looks, but it's based on calculations. And so it's a great way to track progress and to see if athletes or athletes of life are ready to go back to their sport or life or activity. So please send your patients over. We're out of network because we can't afford to be in network and actually spend time with our patients. There's no support staff. I've been a 30-year PT with neuro experience, osteopathic experience. I'll send you great reports and we'll take great care of your people. So especially anyone that really needs a lot of attention, because we have a lot of attention to give. And give us a call. We'll make it easy for you. Thank you.